Welcome to the course's conclusion module. This module reviews the course's key points and tools, discusses next steps to address the healthcare transition in your practice, and closes with instructions on claiming continuing education credit. This course began with a description of the healthcare transition and its importance. Module 2 illustrated how transition and adolescent development progress together. Module 3 identified key strategies and concepts for working with parents and caregivers during transition. Module 4 demonstrated strategies to assess patients' transition readiness. Module 5 discussed using assessment results to create a transition plan. Module 6 identified legal and financial considerations during transition, including guardianship, vocational rehab, and Social Security. Module 7 presented information and tools for patients to maintain continuous coverage during transition. Module 8 described the importance of educating colleagues in adult medicine and strategies to build your referral network of adult-oriented providers. Module 9 examined strategies for transferring patient care to an adult-oriented provider. This section reviews resources from the course and provides links to the tools from each module. Bookmark the Florida Hats website for quick access to the latest news and tools on transition. Here are the specific Florida Hats tools used in this course. GotTransition.org is the official website of the National Center for Healthcare Transition Improvement. This slide contains all of their tools referenced during the course. The ACP's Pediatric to Adult Care Transitions Initiative provides tools for primary care and specialty providers to integrate new transition-age patients into their practice. Resources on adolescent development include tools for the third edition of Bright Futures, tools to develop the patient's self-efficacy, and a guide to discussing sexual health with patients who have developmental disabilities. Module 3 offered tools for using the shared management model with your transitioning patients and their parents and caregivers. The track is available as an Excel document or as a PDF with a separate scoring guide. Module 4 focused on using the track in conjunction with the 3 transition planning guides. The National Center's website and the Illinois Transition Care Project offer additional examples of transition assessments. Tools to develop patient skills consist of the transition plan from the Florida Hats planning guides, the patient booklets for each transition stage, and different activities for specific skill areas. Addressing financial considerations during transition focused on resources from vocational rehab and Social Security. Module 6 also gave resources for patients who will need decision-making support after turning 18. Tools for maintaining insurance during transition include the Florida Hats Insurance Guide for Patients, resources on the Affordable Care Act, from Medicaid, and for private insurance. Resources for working with adult medicine focus on 2 tasks: building your referral network of adult-oriented providers and educating your colleagues about transitioning young adults. To improve the care transfer, use sample transition policies with your practice, the shared management model, and resources from the 6 core elements. The following slides describe statewide efforts to improve transition care. Florida's Transition Strategic Plan focuses on healthcare financing, education and training, service delivery system, and advocacy. To achieve this goal, Florida Hats provides multiple resources for educating consumers and providers about current financing options. It also engages insurers and other funders in developing policies that support patient-centered medical homes for youth. Educational programs are designed to empower patients' independent management of their medical conditions and to increase the capacity of providers to deliver high-quality care. Florida Hats works with communities to develop service networks that span pediatric and adult systems. To date, public-private coalitions have been organized in 4 regions. These coalitions are paving the way for all Florida regions in building coordinated, community-based service delivery. Florida Hats works in partnership with organizations throughout the state and nation towards policies that support all youth with special health care needs in their transition to adult life. State partners include the Florida Association of Community Health Centers, the Florida chapters of the American Academy of Pediatrics, and the American Medical Association, the Florida Developmental Disabilities Council, the Florida Children's Hospitals Association, and many others. Join us in improving care for transitioning patients. Connect patients and families to the wide range of educational materials and resources available on the Florida Hats website. Sign up for the mailing list to keep updated on important transition issues. Through the mailing list, you'll learn about upcoming events, including webinars on a variety of transition-related topics. If you live in one of the regions that have formed a transition coalition, consider joining with others to improve your local system of care. Maybe most importantly, become a transition champion by working within your own agency, institution, or professional association to educate and advocate for policies that support improved transitional care. Review your written responses to the interactive questions throughout this course. Which would be easiest to implement this week? Which would require additional time or resources? Florida Hats, CMS, the National Center on Healthcare Transition Improvement, the American Academy of Pediatrics, the American Academy of Family Physicians, and the American College of Physicians endorse the strategies described in this course. A rapidly growing evidence base, coupled with the growing population of young adults with special health care needs, demonstrate the urgency of implementing these strategies. Select one strategy to use with transitioning patients and families in your practice. Review that strategy's resources and make a plan to integrate into patient visits. Encourage other practice staff to complete this course.
An experience happened to me about 3 weeks ago where I entered Cottonwood emergency room about 11 p.m. at night having an anxiety attack. They didn't ask me what was wrong with me. They asked my friends that took me. Now, as I thought I was coming here today to speak with you guys, I thought, now that's wrong. Who's the patient here? So I kind of got stern with the nurse and the doctor. I says, who's in the bed? Who's wearing the gown? Do you see him wearing a gown? No. I'm wearing the gown. Talk to me. You know, it's because what you see a lot of is the people that can talk, they don't get to talk to the doctor. And that's because the parents are either in the room or just being parents and being nosy.
I'm a success story in this regard. As Justin said, you really have to involve the patient, not just the parents. And probably when I was 10 or 11, I would say, is when my parents were then asked by my pediatrician to no longer be in the room, and I would now be in my own appointment. And as a result, I can now go to my own appointments on my own, talk to my physician, ask my questions, and get all the answers I want.
I think as doctors, this can be helped to be cultivated by encouraging the patients to make their own appointments. We talked about stuff like this in one of our meetings, to have the student or the patient make their own appointments and call in their own prescriptions and keep track of when they need their prescriptions refilled and when they need to get those, and keep track of taking their own medications and stuff. And there's so many things in life that they need to be able to do on their own, but as doctors, I think if you can help push that, that would be at least one little category, that these people can be independent and learn to take care of themselves.
I guess just encourage independence is the whole point. I now cook for myself and for my parents, little deal we worked out. Early on in my life, they taught me to be independent, and I think at this point, Mom had a little song that she used to sing about independence, and it's now come back to haunt her because I tell her to do things for herself. But ultimately, I think independence is a very important thing. I was able to go off to school. I can show my friends what I'm able to do. Physicians, I think, ought to ask, is your child able to do their laundry, to, I don't know, balance a checkbook, and encourage parents to get their kids involved in that sort of thing.
I had some questions about future situations around the time that you start to question about your body and things, whether I could have children and things like that, but you just don't feel comfortable asking it when your mom's right there because she doesn't even know you're thinking about it, or she doesn't think she knows, but I think if the doctor takes a moment to realize that the child is in the portion where they would start to think about sexuality, maybe take a moment or encourage the child to ask questions, or maybe ask the parent to step out of the room for a minute. So.
And I'll go back to the age when I was 12 and had my first IEP. And having that first IEP, you don't know who to really involve. You don't know whether to involve your doctor, of course you're going to involve your teacher, and of course you're going to involve mommy, but do you involve the doctor? The answer to that is yes, because then the doctor can be informed of what your goals are in life without you having to retell them maybe an hour later.
I know when I was growing up, this is kind of touching back on learning skills at a young age. I had a person that worked for Jordan School District come out to my house maybe once a month to help me learn how to adapt my house to make it more accessible for me as far as marking appliances so I could work them by myself. And I think that's important, and becoming independent at a later age is, learning those things at a young age and having it be a part of your life before you have to go out in the world and experience the things that brings.
We need to stop and think, whose life is this that we're making decisions about, and what does this person want and what does this person need? And I don't think it's very good for parents and teachers and doctors and professionals to sit down and decide this person's life and their path, and to make decisions for this person. People with disabilities they do have dreams, and they do have goals, and they do have things they want to do, and they have fears, and they have worries and concerns, and this is the person that has to deal with the disability more than anyone, is the one with the disability, and they need to be able to have control of where their life is going and what's going to become of their life.
What one thing do you wish your doctor had maybe helped you communicate to your parents?
One thing is how to explain the disability in layman's terms. I actually had to research it myself a little bit when I started to get interested in it. My mom because I lived a life of quote-unquote normality for so long, when I'm like, what's this kind of surgery? What happened here? She doesn't remember. So something like asking the doctor to explain it to me in layman's terms or something. And now that is my responsibility to ask, but when you're younger, even when you're 5 or 6, if the doctor can explain, this is what's going on, then you're more likely to understand what your disability is when you get older.
What would you tell your primary care provider is the most important thing for you in transitioning to adulthood?
Just plan earlier on. I came back from college after not having any kind of interaction with my pediatrician for a couple of years, and then asked him, so who do I go see? And he had no idea. And I think it's probably a lot harder to find an internist or someone who's willing to deal with someone with special health care needs than it is for a child who doesn't have special health care needs. So plan earlier on. To me, all of these tips come down to the idea that people with disabilities may present more of a challenge, but ultimately their goals, everything that you do as parents, as physicians, is going to be fairly similar for someone who has a disability or doesn't have a disability. They just present additional issues that you need to work around.
This closes Part 2 of the course. Return to the AHAC website to take the post-test and evaluation for CME.